there were three categories that were exempted, because what the government wanted to do was make sure that people that were quarantined still had access to necessities. Okay, so employers that had 500 or more employees, right? The Amazons, Targets, Walmarts, etc. They could choose to opt out of this if they wanted to, right? The thought process behind this is, look, everybody's at home. They need to have access to groceries and basic necessities. We can't have Target employees off, right, and have them shut down, because all hell's going to break loose, right? So how do we kind of keep them incentivized to keep their doors open? Same thing for healthcare providers, hospitals, doctors' offices, senior care facilities. They were also able to exempt themselves from this law. They didn't have to offer the supplemental leave for their employees. And I know on my slide here, you see the car, it says employees who leave home to perform work. Think of that as your delivery drivers, your essential employees, delivery, food service, right? Grocery stores who are, and agricultural workers who are kind of making things go and keeping the supply chains moving, okay? So what this piece of legislation did, I think we were like the 4th or 5th state. Colorado did this a couple months ago, as well as Illinois, I believe, and we kind of followed suit a little bit late in the ball game. But Governor Newsom came in and said, hey, look, any business in California all businesses, I should say, in California must offer this to the employees, okay? So there's no such thing as an exemption for certain business industries anymore. Effective immediately, any business, if you have an employee who meets one of the requirements, right, for whether they're COVID positive, or they're seeking a test, or they're caring for somebody who has COVID, or they're dealing with a child care issue, they have access to this supplemental leave, okay? So there's not really, a whole lot of panic that needs to go into this. Most of you, I think 90% of our clients already offered the FFCRA benefits back in April when they came out. So if you're already offering, then you're good to go, okay? If you're in one of these categories and you were kind of exempting yourself at the beginning, no problem. Now effective September 19th, you have to entertain those requests from employees. You don't have to go back and run adjustments on payroll or anything like that. You're just going to want to make sure that moving forward you have a process in place, okay? SB 1159, this deals with workers' comp, and the kind of the Cliff Note version here is that at the very beginning, when we first started dealing with COVID, the California Department of Industrial Relations created a rebuttable presumption. What that means is that they're going to give the employee the benefit of the doubt, right? Which, shocker, right? That's how everything works in the state of California, where the employee gets the benefit of the doubt. My view on this is that they did not want employees who potentially were uninsured, right, dealing with the burden of having all these medical bills and all this, these issues with COVID, right? The same thing, right? Why unemployment kind of went up there for a bit, that the federal government kicked in. They don't want employees making a judgment call and kind of being backed in a corner like, hey, you know what? I'm not getting paid. Medical bills are going through the roof. I'm returning to work. I feel good. I'm coming to work, right? We don't want that to happen. We don't want somebody, having to make that decision based off of their health or their income, and kind of coming in to the workplace and maybe infecting other employees or clients if you're a client-facing business, right? So what they did is they said, hey, look, you know what? We'll allow employees to kind of go down the workers' comp path. They can make a claim for benefits, and we'll entertain it, right, until we find otherwise, right? Until we look at their Facebook and we find that they were in Vegas last week, then we'll just deny that and they'll be on their way, okay? What this change in SB 1159 did is it kind of switched the burden back, and it kind of leveled the playing field, okay? So as an employer, the only thing that you need to make a note of here is you have an obligation now, so back through July 1st, I believe, okay, of notifying your workers' comp carrier of any positive tests only, okay? So if you have had positive tests from July until today, no problem. You're just going to want to call your workers' comp insurance carrier at some point in the next day or two and let them know, hey, employee Brett Strauss tested positive back in August. He never mentioned that it was work related. He told us he was at a family gathering or whatever the circumstances were, and pushed the burden back onto the insurance company. That's what you pay them for. It's not your job to kind of go through an investigation and worry about what's going on. Let the insurance company know. But we just want to make sure that we are being forthcoming with the carrier so that they know what's going on. And a lot of the carriers now are having access to different support services. So if you do have a situation that they can help you, they can point you in the right direction. Okay, and this kind of dovetails into the next piece that I'm going to talk about here with 685. Okay, so this is a big deal in my opinion. AB 685. Still waiting on a little bit more information, so we might have a webinar in and of itself just on this moving forward. But this is going to be a big deal here in California to kind of level the playing field when it comes to safety issues. And I want to spend a few minutes on this and kind of give you my feedback, because I've seen a lot of problematic behavior by employers over the last few months. So my opinion is that this is been designed to kind of give people one basic protocol so that everybody can follow it and there's no misunderstanding. Okay, so right now I think we kind of sit on the border of San Bernardino County and LA County. We're right here in Upland. A half mile down the street is Claremont, which is the LA County line, right? Orange County is maybe 20-minute drive down the street from us. So we're kind of in a unique spot that we have a lot of clients here locally that are all connected. They've got employees that work in each of these counties, and it's kind of crazy and very difficult to deal with, because in LA County, right, you have a reporting requirement. If you're a business and you have 3 or more positive tests within a 14-day period, LA County expects that you call the Department of Health there, and then they're going to kind of pretty much take over, right? They're going to manage this for you. They're going to help you get the testing and manage the results, and they're going to, they may or may not come out there and visit you and make sure that you don't have an outbreak, what they consider that. Okay. Orange County, right now, Orange County is in its own planet, right? Everything's open. We've got kids going back to school next week, I hear. So, it's like, COVID evaporated down there in Orange County. It doesn't exist. And there's no such thing as these reporting type of requirements, right? And San Bernardino seems to be kind of in the middle, right? We've got a client of ours in San Bernardino County. It's a car wash. They unfortunately had a couple of guys that went to a party and tested positive. And that's frightening, right? Because these guys are getting inside your car, right, and scrubbing it and making it look nice and detailing it. That's a problem. Like, hey, we might need to shut this down here for a second, guys. And how do we manage this thing? And what does San Bernardino County say? It's great. There's not really any kind of requirement. So a lot of businesses are pushing the envelope, and I told this story to a group that I was speaking in front of earlier this week. All different types of businesses are managing this differently. Right, we have a nonprofit client of ours that deals a lot in the social services aspect, and they deal a lot with the public. They had one volunteer, right? One volunteer who hadn't been in the workplace in a few days that tested positive, and their reaction to this was, oh my goodness, we're going to notify everybody. We're shutting down for a few days. Right, and they shut their doors for 3 days, and they helped everybody get tested, and they kind of went through all of their protocol. Do I think that was the way to go? Very conservative in my opinion. I didn't necessarily think that they needed to shut everything down and halt operations for 3 days, but that's just the decision that they made as a board, that they wanted to be rather safe than sorry, and they wanted to be overly cautious because the goodwill that they've built in the communities they serve, right? The last thing they wanted is to get out on the news or on social media that so-and-so had a COVID outbreak, and it would damage their credibility. So they went that route, right? There are a lot of restaurants that I'm familiar with. I've got nieces and nephews that are college age that are working in local restaurants to put themselves through school. And some of the decisions that these restaurant owners are making are outrageous in my mind, right? So not only are they not notifying their customers, they're not even notifying the employees, right? These employees talk to each other, right? Because, hey, can you cover my shift? Yeah, why? Oh, yeah, I tested positive for COVID. Huh? So the manager never told me that you had COVID. We worked together last night at the dinner shift. And these people are like, why aren't you notifying us, right? Why aren't we taking basic precautions? So I think 685 is going to come in. OSHA is going to be kind of the judge and jury here, and they're going to be able to issue stop work orders. They'll be able to come into these restaurants and completely shut them down, right? If they have outbreaks or if they're not following the protocol. So I think this is good in my opinion. It eliminates a lot of the gray area. So there's going to be a step-by-step. Hey, if this happens, then you have to notify this, notify this, and here's what needs to happen. And I think it'll be great. So that way employees can feel safe. The public, if you're dining at some of these establishments, or you're going to these car washes or other businesses that serve the public, you'll be able to have a peace of mind in knowing that everything's on a kind of a level playing field. It's kind of like how the health departments, right? If you're a restaurant or in food service, and they put that letter grade on your window. Same kind of thing. I want to know that if I'm going to go to a restaurant or to a Target or whatnot, they haven't had a COVID outbreak, and if they did, they've at least sought guidance from professionals on how to kind of make it safe for the public. Okay. All right. Moving forward in here, this is a little bit more operational side on the payroll piece. Employee retention tax credits. I've had a lot of questions about this over the last few weeks. Before I walk you through this, just the star on this slide is, if you received a PPP loan, then you are ineligible to receive the employee retention tax credits. Okay, so you might take a break here for a second. If this is you and you've received that, then you don't necessarily need to pay attention to it, but I know we have a lot of clients that have not received the PPP loan. They applied and they got stuck and they went through both waves and they weren't able to get those funds. So if that's you, then employee retention tax credits are available. And what that is, I pulled up the IRS so I can give you the specific language right off of the website. It's it allows an eligible employer to take a payroll tax credit for retaining your employees during the pandemic. So you would have had to have been affected by the COVID-19 pandemic, okay? But you made a conscious decision not to lay off employees, to possibly furlough them for a little bit and kind of bring them back. And you're able to claim a credit against 50% of the wages that you paid them from March 13th through the end of this year, okay? And it's up to $10,000 per employee, okay? And your payroll provider should be helping you manage this, okay? There's a Form 7200 that needs to be filled out and remitted to the IRS, right? All of the wages are tracked in payroll. Your payroll provider should be able to automate this for you and make it nice and easy so that you don't have to pull your hair out and try to figure out how to calculate all this stuff. Okay, there's a simple calculation that you kind of plug in, and you can run the report for that date range as you get closer to the end of the year. Okay, and then the payroll company can plug in the formula there and tell you, hey, this is exactly how this works. We'll help you fill out the Form 7200 and be able to get you the credits there that you're allowed under this specific piece. So this was a part of the CARES Act, all the way back in May. They started clarifying it, had 3 or 4 different updates. Another thing I wanted to mention, I forgot to talk about at the very beginning, is I hyperlinked all of this stuff in the slides. So once you get the presentation, you can click on that and get more details. But again, if you have a question on this and you want to kind of figure out, hey, is this something, am I eligible? How do I do it? Again, your payroll company should be able to tell you. If not, please reach out to me. This is what I spend a lot of my time doing for our clients here at SDP is walking them through this and making sure that they've got all of their reports in a row so that they're not scrambling, right? So because we just started the 4th quarter, now's the time. You don't want to be messing with this, between Thanksgiving and and the end of the year and holidays and everything, and it'll just add a lot of mess to your plate. So now's the time to kind of start asking the questions to make sure that you're on top of